Module 9.2 Integumentary System Diagnostics. Integumentary system diseases, which are also referred to as dermatologic diseases, are conditions that affect mainly the skin but also includes diseases of the hair and nails. In this module, we will discuss how to diagnose such conditions. We will look into the medical history and physical examination. Common diagnostic tests used will also be covered, such as patch and intradermal skin testing, skin scraping, culture, and biopsy. As partners in healthcare, it is important that we know how to identify these diseases so that we may be able to understand the needs of patients and doctors as well. This way, we will be able to effectively communicate how our products can help them manage such conditions. Common signs and symptoms during physical assessment include rashes and itchiness for skin diseases. Since a number of skin diseases present with these two, it is beneficial to probe further for history of fever and allergies, as these give important clues as to the right diagnosis and consequently the right intervention. Infections usually present with fever, while allergies are triggered by contact with identified allergens either through inhalation or direct contact. The description of the rash also provides valuable information as to the correct diagnosis. For example, rash that is described to be red, itchy, and scaly, triggered by use of detergent, points to a diagnosis of eczema. Scaling and flakes on the nails are common complaints for fungal diseases. Note that fever and presence of lymph nodes are indication for infection. Skin lesions like any type of rash, masses, and bumps warrant further investigation. Let's discuss several diagnostic tests to confirm dermatologic conditions. Number 1. Common skin tests that include patch and intradermal testing are done to confirm diagnosis of allergy and identify the allergen or the specific substance that causes it. Presence of redness and swelling in the area indicate an allergy to the specific allergen. Number 2. Skin scraping is done to quickly confirm a diagnosis of fungal skin infection. It is done by scraping some materials from skin like flakes or scales, which are examined under a microscope. Number 3. Culture tests are done to identify the pathogen causing the infection, whether it is bacteria, virus, or fungus. Skin scrapings, pus from pustules, content of blisters, and even hair and nail samples are cultured in the laboratory. Growth of either bacteria, virus, or fungi is detected after a few days, and the cause of the infection is identified. Number 4. Biopsy is done to confirm diagnosis of cancer and benign skin disorders. During this procedure, a small piece of skin is removed from the affected area and examined under a microscope. After going through the discussion on integumentary system diseases, we now have a glimpse of how such conditions can be diagnosed. It is important that we keep these things in mind. Number 1. The skin is the most common site of integumentary or dermatologic disease. Number 2. Rashes and itchiness are the most common signs and symptom. Number 3. Skin biopsy confirms diagnosis of skin cancer and benign skin conditions.